Ramp up now. Joining us to talk about this is Georgia Republican Congressman Buddy Carter. I love talking to Congressman Carter for a lot of reasons, but one of which is that he is the only pharmacist serving in Congress. He was there when the president announced his plan. He joins us in the White House. Congressman Carter, I read the plan. It's actually pretty good. Alex Azar understands the industry because he was a president of Eli Lilly in America. The president carrying on about other countries extorting, it really has to be put into context. The American government can't negotiate prices. The Canadian government can negotiate prices with pharmaceutical manufacturers. Isn't that the heart of the problem?
Well, I'm not sure it's the heart of the problem. I think what the president is also saying is that, the intellectual property, the research and development that we Americans pay for is being stolen, essentially, by other countries. And they're using it and getting cheaper prices on these medications that we have to pay so much for. But Dolly, today is a great day for American consumers. This is a president who truly gets it. He understands what common people are struggling with. I mean, if you look at what he's done, the Tax Cuts and Jobs Act, now addressing prescription drug prices, what we've done to increase our military spending, all those things are things that people are concerned with here in America. Well, kudos to this president.
I don't get as much chance to talk to you as I like, so I want to stay focused on prescription drugs for the minute. Sure. One of the things the president said during the campaign, and he said now, and I agree with you, that I don't think the negotiation is the heart of the problem. I do think pharmacy benefit managers and the middleman, as the president calls them, might be a bigger part of the problem. Listen to what the president said about that today.
We're also increasing competition and reducing regulatory burdens so drugs can be gotten to the market quicker and cheaper. We're very much eliminating the middlemen. The middlemen became very, very rich.
So I don't find myself agreeing with the President of the United States all that often, but the middlemen are a big part of the issue. It doesn't exist anywhere else in the world. There's no pharmacy benefit managers in the way they are in the United States anywhere else in the world. How on earth do you get rid of them?
Well, we can get rid of them. And again, here's a president who truly understands. I've always said the most immediate, the most significant impact we can have on prescription drug prices is to have transparency. The PBMs, the middlemen, now they will tell you, if you ask them, what is your mission? They'll say, well, it's to keep prescription drug prices low. Well, how's that working out for you? It's not working out well at all. They bring no value to the system whatsoever. And what they do is they increase the price of the medications, and they don't pass the discounts on to patients, to the consumers.
So what's the solution? I mean, let's just think big. How do you make drug prices more accessible to consumers while ensuring the drug companies make money so that they can continue to develop drugs? They make the argument that they make lots of drugs. They don't make money on some of them. They need to have big blockbuster drugs, and they've got to get a lot of money. What's the recipe for success here? As a guy who's a pharmacist who's actually had to deal with customers who probably have difficulty paying for their medication, what's the big answer for you?
Transparency, no question about it. Transparency is the key here, and that's all we've ever asked for with the middlemen, with the PBMs, is just to show us what's happening here. Why is it that when I speak to the manufacturer of EpiPen, Mylan Pharmaceuticals, and I ask them, when it leaves you, how much does that medication cost? It costs $150. Yeah. And I said, okay, when it gets to me, the pharmacist, is $600. What happened in between?
Yeah.
What happened there?
And do you think, when you talk about transparency, I think of, stories that we've done in the last several years about drugs that were increased in price by hundreds of percent. The shaming, certainly from the media, didn't often cause companies to do anything about it. So what is the feeling that if they're transparent about pricing, then what will happen? There'll be public pressure to reduce prices? I mean, people can't boycott their cancer medication.
Well, you're exactly right. And what will happen is that what the president has proposed is to have the discounts applied at point of sale. Let the patients see the discount when they buy the medication. That will make all the difference in the world.
What's the problem with the fact that the pharmaceutical companies are some of the biggest lobbyists in your part of town? I mean, they have influence. They have a lot of influence. They are able to give talking points to members of Congress that have prevented real legislation from coming into effect that allow the American government, Medicare Part D sponsors to actually negotiate lower prices. Again, the president kept talking about other countries. I come from Canada, as you know, where they do negotiate the price of drugs because that's what they can do.
Well, and that's what the president has proposed, too. I mean, he identified that today. He said, look, we need to be able to negotiate on behalf of, as you pointed out earlier, the largest payer of the payer in the whole drug system is Medicare, and they need to be able to negotiate prices as well, and that's part of what the President and Secretary Azar are proposing.
All right, Representative Buddy Carter, always a pleasure to talk to you. Thank you for joining me. Buddy Carter is the only pharmacist serving